My name's Dr. Monica Handler. I'm the principal chiropractor here at Warrington Optimum Wellness, and I have been here in practice for many years, like over 30 years I've been in this practice. How many of you have sought some type of solution for your current shoulder situation?
Just sign in.
Okay. So does anybody, whilst we've still got people filtering through, does anybody want to give us some information on what it is that you've currently tried?
So I was using osteopathy.
Osteopathy, okay.
So that was more for like nervous system regulation after like all the infections which affected my musculoskeletal.
Okay.
And then felt like we reached the wall already, you know, after like several sessions.
Okay.
It was just like temporary.
Okay.
And then I used to go to this person who did like the myofascial release.
As well. Yeah.
And that improved. Like for some reason I couldn't carry on to go there. But I feel like it gave me some improvement.
Okay. And anybody tried any other approaches at all?
So I went to the doctors to get an appointment with physio. Saw the physio and she examined me and she gave me a strap to do exercises. But some of them exercises involved me moving the arm and it was crunchy and I didn't like that.
Okay.
And it was hurting as well. Tried to make another appointment. 3 weeks later, here I am.
Okay. Any other approaches apart from GP physio?
I've just got some exercise my GP didn't give me.
The same. Okay.
I just got painkillers.
Painkillers, okay.
Steroids.
Into an injection into the shoulder, okay.
Yeah.
And do you know how many injections you can actually have?
I think it's 3, but I have 4.
Okay.
I actually
You tipped over the balance anyway.
okay. From the physio, because of nearly 20 months now I've had it, and then finally got referred to the hospital, and they'd done ultrasound and done 2, and that's just wearing off now. But I think I'm having an operation next.
Okay.
Yeah.
Perfect. Anybody on this side want to volunteer what it is that you've had done, what approaches you may have tried? This side seems to do all the talking.
Physio.
You're awaiting physio. So how long ago did you have your consult?
Only a couple of weeks ago.
Okay. So it's not been a long time now. So does anybody know? Sorry, Jill.
I've had a deep massage here.
Yeah.
Oh yeah, also sports massage and acupuncture on top of everything else.
Okay. So many different options we've tried. Okay, and you're sat here because I'm assuming it's because of the fact that either you want to just find out more information about what it is you can do to help yourself, or you may be frustrated with the lack of progress you've made with the current option that you've been given. Am I on the path there? Okay. So why do you think it is that the current approach that you may have taken may not be working? What's the simplest answer to that? It's the wrong approach. Yeah, absolutely. So it's likely going to be that if you're taking medication and the medication doesn't seem to be resolving the situation, what does that tell you?
It's not the root cause.
It's not the root cause. It's not because you've got a lack of medication in your body that you are experiencing the symptom. Okay? What have you been told, if anybody wants to volunteer, again, what the cause of your problem is?
I got told it was degenerative.
Okay? Well, it sounds like it from the fact that you told me that it's crunchy. Okay? Does your other shoulder make the same noise?
No, but I do get pain in that shoulder. Not as much.
Okay?
About 5%, you know.
In comparison to the other side, yeah, okay. And did you have an x-ray taken of the shoulder for a diagnosis that it's arthritic? Okay. So, does medication resolve the root cause of the problem?
No.
What is a medication going to do?
Short-term solution.
It's a short-term solution. Sometimes it might be necessary for us to kind of get over that pain barrier, but it is a short-term solution. Does anybody know how the medication is going to work within your body?
example, inflammation.
So it could be, so what kind of medications have you been given for the problems? Naproxen, okay, which is, anybody want to volunteer what that is? It is an anti-inflammatory. And having taken the naproxen, have you found that it's helped you at all?
No.
Okay, so, yeah,
Yeah, no, it's basically that.
okay, okay.
It's like having cold, you know, like it just eases the symptoms, but the cold goes away on the fixed.
Potentially. Exactly, right? So we know that you may have, so the other question I've got to ask is, you've got two shoulders, right? And apart from this gentleman here, how many of you have got a similar problem in both shoulders, or is it mostly, hands up those of you who've got the same problem in both shoulders? Just you, okay? So just look at that amongst the people that we've got here. You've got pain in both, but you might have the immobility only in one, right? So if you're being told that it's wear and tear,
Why is it in this one?
why is it only in one that you've got the amount of problem that you have? Okay? So this is the same with any joint that we look at, is that if you're being told it's wear and tear. Now, if you have spent all your life kind of like leaning on one side, then that might be an overuse type of an injury. However, if we've got two shoulders and we've already decided that it doesn't matter whether you're left or right-handed, it could be either side that gets the problem, then it feels like it's a little bit random so far. Are we in agreement that, that there doesn't seem to be any rhyme or reason for it? So we've discussed that we may have a choice, that we've looked at medication potentially. We've had steroid injections, you've had 4 when the maximum number is 3. Do we know why it is that we normally have a maximum number of 3 injections into any joint? Okay, because it makes the tissue very thin. Okay, that's the reason why it is, because steroids are produced within your body naturally, but to help reduce the inflammation, it can be a potential way of managing the situation. But once you get beyond 3, it's not recommended for you to continue to have that, because it can create further damage within the joint. Okay?
Can we just say I've also just been offered Botox by a neurologist?
You've been offered Botox, yeah?
All medication, which I wasn't too fond of.
Yeah. Okay, so again, that is going to be to like just blocks, you kind of like, yeah, exactly. Okay, so guys, could we turn the heating down, please, because it's rather warm in here now. So you've tried medication, you've tried some exercise. So we would all assume that exercise is the way forward, yes or no? Right? Because if you've got something that isn't moving, then the thought process is that, well, actually, we just need to get it moving again.
Trying to move a little bit, but it's not just exercise.
Okay.
I've got full mobility, it's just aches.
Okay. And has anybody been diagnosed with a frozen shoulder? So one gentleman there. And then again, were you given exercises to do? Yeah. Okay. So the thing is that when we're talking about like all the generic situation, what are the limitations you are experiencing? Let's just I'm going to go for this side of the room again here now. So what limitations are you experiencing? Is it just that, like you just said, it's an achy shoulder? What other things are you noticing?
If I do wiggle it, does click and grind and whatnot.
Yeah,
very. Not full movement.
Yeah.
It's just sleeping as well as the worst.
Yeah.
So a lot of people are impacted with their sleep. Why do you think that might be? Because you lie on your side to get off to sleep, okay? And that's why oftentimes that's usually when people will start to think about going to see someone, when it is that you have that continued impact on your sleep, because of the fact that, I don't know about you, but I'm very grouchy when I don't get enough sleep. So, we all become a little miserable.
Yeah, just have a question if there could be a link between like the pelvis and shoulders as well.
Definitely there can be.
Because
Definitely there can be.
I mean, I'm not that bad really.
In comparison.
I feel sometimes, like this side foot, like it's like stiff more and it goes there, but obviously I know how to like release it. So
With
it helps me.
the massage,
Yeah.
okay. So going back to this side of the room again, what other limitations are you experiencing? Like what movements are you struggling with?
I can't lift my hand further than that.
Okay, and how long have you had your symptoms for?
4 weeks now.
Only 4 weeks, okay. Anybody had their problem, obviously you've had yours for around about 20 months or so. Anybody had their problem for longer than 4
Oh,
weeks?
2 years.
4 years.
I've been struggling for a long time, for 3 months.
3 months?
Yeah.
Yeah.
4 months.
4 years. 4 years.
4 years and weeks.
Right, okay. Anyone else beat 4 years? Okay, and what approaches have you tried then?
I had the injections.
You'd have had a steroid injection?
Yeah. I can get 2 in the front, 2 in the back over a period of time, and then it's gone straight into the joint.
And did it impact it at all when you had those injections?
Not the first ones, but into the joint itself.
Mhm.
Did.
Okay.
For a period of time.
Righty-ho. Okay. What were you going to say? No? Okay.
I struggle with lifting certain positions. I get a real pain and I can't lift. But if I get in the right position, I can.
Yeah.
So it's a bit weird, really.
Okay. So what everybody is saying to me so far is not anything that is surprising me at all. So we've talked about that some of us have got just an ache, but we can hear some odd maybe clicking and grinding, we've got crunching, we've got difference in movement, so somebody can't get their arm above a certain point, somebody else can move it, but only in certain particular direction. So I think that pretty much covers all of the range, and then we've got those that maybe only had their symptoms for a couple of weeks, 4 weeks, all the way up to around about 4 years or so. So that's like a snapshot of the people that we have in front of us here. So may I ask you a question, which is that what is it that you would like to know from me?
How to get rid of it.
Okay, that's what I thought, but I don't like to assume, because although I may provide you with a solution, it may not be the one that you're looking for. So I'm just going to, put that forward there for you.
Yeah, I would like to know how to look after my shoulders and neck, because mainly it's, I feel like it's very often like overstretched because I work as a hairdresser, and obviously it's like, that.
You're using your arms a
Yes,
lot
I
of the
do.
time, yeah. So who here finds that it's affecting them occupationally? Yeah,
How to quit my job.
you've had to quit your job. What about you?
I'm retired now, but it's affecting everything else, sports and housework and things. It's just affecting housework and sports and stuff that I used to do.
Right. What kind of sports?
Badminton.
Okay. Yeah, it will do. And it's your right shoulder, is it, that's affected? So obviously you can't. So we've talked about sleep. We've talked about work that it may have impacted. What else may it have impacted?
Can't drive because of it.
Yeah. Okay. And how many of you have actually had a full, proper investigation done of your shoulder?
I do have the ultrasound.
You've had an ultrasound done, and what did the ultrasound show?
They just say like normal.
Okay.
Then they just recommend me to book an appointment to maybe do X-ray for my neck.
I get one.
Okay.
That's
You
the
can't get
sign.
an appointment.
I get
Okay.
an appointment and then they just look at it and refer you to the
MSK.
yeah, and then nothing happened. And I've asked for a scan to just see what I want to know what's wrong with it, or if it is something wrong with it.
Okay. And so how many of you know what it is that might have brought on the problem? What do you think it is?
Brought on that probably was dislocated shoulder.
So it was a trauma that you had. So you fell, did you, onto your shoulder, or?
Yeah.
Okay. And do you have hypermobility in the other side as well, or is it just that left
Just
side?
that left side.
So do you know that it's a hypermobile joint on that side?
No, not really.
No. Okay. So it was like a. Did you have like a proper shock? Which what happened?
Posterior dislocation.
It was. Yeah. That's usually the way that they dislocate. Yeah.
That's all they said.
Okay. Anybody else want to volunteer what it is that they think might have brought on the problem?
Maybe because I'm high, I sleep without pillow for a long time.
Right?
So this is one of the problems.
Potentially. Yeah. What do you
I
think?
guess in my case will be dysregulated nervous system.
And what it is that you're doing occupationally, potentially as
Yeah,
well.
like lately I'm very aware how I'm standing, you know, like before, like back in, I've been doing this for 10 years, so before I was just like curving,
Mhm.
and now I just feel like, you know, just like stretch my pelvis more forward kind of, yeah,
Okay.
and just like to, you know,
Holding yourself a
hold
bit more
my
upright.
chest higher and straight shoulders as well, not to, how I keep the scissors as well, it matters. Not like this, but like more like
Especially
straight.
for someone on the other end of the haircut as well.
Yeah.
Okay. Okay. And
I think mine was driving because I'm a courier. I'm
okay.
changing gear all the time, and I think that's what's started it.
Okay. Anyone else want to volunteer what it is that they think?
I've done 46 years of being a mechanic, I do a lot of heavy lifting, and mine just went.
Overuse potentially. Yeah. Okay.
That's
The
the
thing-
thing. Dog walking.
Is that just the pulling on the lead or?
Every now and again I get a dog that doesn't walk well, yes. And I think most of my shoulders.
Sees a squirrel and off your shoulders semi-dislocated.
I've got an old dog at the moment. I
Oh.
don't think he's ever been taught to walk on a lead.
Oh.
And it's only a Shih Tzu, but it can't be as strong as a
Yeah.
box. and he had me over.
Oh.
You know, so I had a shoulder problem before, but I think he didn't help.
Okay. And anybody else from this side want to kind of hazard a guess as to why it is you may have got your problem?
I don't know, but I'm guessing over a decade work in front of the computer, like this, you know,
Yeah,
hours a
yeah,
day.
yeah. So the most common thing, there are many different causes, okay? So many different reasons. So one of them may be overuse, okay? So after many years in the same position for a period, you know, that we've abused our bodies basically, that could be a contributory factor. Does that apply to anybody else, anybody here? That it could be as a result of the fact that you've just held yourself in the wrong position for a long period of time. Yeah, that could be one. The other could be that you've actually got like a genetic predisposition, which is rare, but it could be an issue. It could be that your shoulder has a degree of what we call hypermobility, too much movement in the joint, which then means that if you were to have a fall or an injury, then you're more likely to hurt yourself because of the fact that the joint isn't as stable as what it should be. Okay, and everyone knows that it's a ball and socket joint, that you know that your shoulder, it's not as deep as what it is that we have in the hip, but it's like if this is the shoulder, then it sits in a small socket within the joint there. So what we find is like we've said, that we can have an overuse, we can have, it could be as a result of a genetic predisposition, but the most common reason is what it is that they've done with you, which is that they've said is they've done an ultrasound to the shoulder and said that the actual shoulder itself appears to be normal. So you're the only person who's had an ultrasound, you've got an arthritic shoulder and you know that as a result of an x-ray. Nobody else has had any investigations done.
Yeah, I have.
Oh, so what was your investigation, sorry?
I had ultrasound and everything, I had a partial tear on it.
So you've got a partial tear, okay. Now, with the diagnosis of the partial tear, the problem that we've got with the method of analysis, which is, you know, the ultrasound, etc., it doesn't always tell you how long you've had the problem there for. So just because you've seen a tear on the ultrasound doesn't mean to say that that's happened recently.
Oh no, it's happened to me on fault.
So what did you do?
Climbed up 2 boulders and slid all the way down from the roof to the
So
top.
yours was traumatic, okay, okay. So anybody else, that when you go, if you end up going and having an evaluation done and you go and have an investigation in form of ultrasound, x-ray, sometimes as far as an MRI, then what can happen is that you are then told potentially that you've got a tear. or it's arthritic, or but if that is not related to any specific trauma, yours is obviously traumatic, you've had a trauma, but if it isn't a trauma, then, and it's not overuse, then what is it?
Genetic, yeah.
Well, can't be everybody that's genetic.
Stress, emotions.
Could be. So how is that going to impact you? Like, why would it be stress that impacts you?
Tension in muscles.
We're getting there. Okay? So if it is tension in the muscles, then surely the exercises would help that, because that's the muscular system, yeah? Are we following here that if it is the muscular system, then massage and stretching and movement is going to help. Has it helped you?
Yeah, exactly. I've exercised it from what the doctor told me to do, and it's a lot better than it was.
Okay, so there's definitely a muscular component, and this is the problem, is that, as we've seen, there's like a whole range of people here, from, like we said, from one end of the spectrum to the other, and we're going to have all sorts of answers. But what I'm here to tell you is that that's the thing, is that it's not just a one-size-fits-all. It's not just, right, well, every single person that is sat here with a shoulder issue, that it's all going to be the same cause. But there are common causes. The most important thing is what this lady came across here and told us about, the fact that she's had an investigation done, the shoulder showed up as normal at the stage that you've had it, and I think you're super lucky to have had an ultrasound and you've only had your symptoms for 4 weeks. That's just almost unheard of.
That's in there for 3 months.
3 months, sorry, 3 months. You've had the problem for 3 months. Even that still is pretty good going, I would say, okay? So you've had an investigation. It shows that the joint is normal. Why do we then think that she's been told, sorry I'm calling you she, that she's been told to have an x-ray of her neck?
I think it's just like a connection between neck, like L.
C.
Yeah, the C1 which is connecting to the shoulder and muscle.
Potentially, okay? But with the shoulder, where does the nerve supply to the shoulder come from?
Right.
It's actually from your neck,
Yes.
okay? So that's why it is that they've said to you, and I would probably say appropriately, let's get your neck investigated.
Yeah, they've done that with me.
Because of the fact that the nerve supply to the shoulder comes from the lower section of the neck. If you have desk postures, and who here thinks they've got beautiful posture? Who thinks that they could improve on their posture? Everyone's hand should probably go up there, okay? So when we are looking at your posture, that is what we see from the outside. The X-ray is going to show you, number one, what do we think the X-ray is going to show us?
Not a lot.
Not necessarily, depends upon who's looking at it. It's going to show us the bones. It's going to show us your bone. It's going to look at you see your spine. Okay, that's what you're looking for on an X-ray. You're going to see the bones on an X-ray. Why are we interested in seeing the bones on the X-ray for the cause of the issue within the shoulders? Because it's not the shoulder that we're X-raying. So what are we doing?
Curving.
Damage.
Bone curve.
Damage. Yeah, we're potentially looking for damage within the joints within the neck. Okay. What kind of damage is the most common thing for us to see on an X-ray?
Yes.
You don't see that on an X-ray, but you would. It could be bones fusing together. Could be
Arthritis.
arthritis. Arthritis is the most common thing that you're going to see, and in the joints in your neck, unfortunately, the most common place for you to get arthritic changes is in that lower section of the neck where the nerve supply to your shoulders comes from. That's the most common place for you to see degenerative change. Now, The question is if you have arthritic changes in your neck and you are now you've got a shoulder problem, is that arthritis going to go away?
I don't know yet.
Is it reversible by doing all
It's
this?
not. Once it's changed, it's changed. It's like boiling an egg. Like you can't go back. Right?
It can be maintained, yeah.
It can be maintained though, and you need to have intervention. But you know, once you've gone down that route, could somebody bring me the generation model? And I'll just show everyone. So once you've gone past that normal stage and it's now worn, you can't, you know, unless you have some real forces, which is something that we can go down the route of in here, but you're going to find you're going to struggle because of the fact that your spine potentially has gone from looking nice and normal like this to potentially down the road here. So going back, as you can imagine, from this stage here to looking more like this stage here, that's not really possible. Alright, so I'm never going to say never because miracles happen all the time, but it's not something that I've ever seen in 30 years in practice. Okay, so if you've got that arthritic change in your neck and then you get diagnosed that the shoulder problem is as a result of that arthritic change in the neck, then what are you supposed to do?
Pain relief.
And what's that going to do?
Short-term solution.
What's it going to achieve taking medication?
Probably nothing. Just risk it. Yeah. Short-term solution.
Yeah, so it's just going to mask the problem because of the fact that you may have arthritic changes in your neck. They're not likely to be reversed. And if you have arthritic changes in your neck, you may be recommended anti-inflammatories depending upon how much inflammation is in there, and that may help, okay? So how have you got on with your anti-inflammatories so far?
Yeah, that's making no difference.
Okay, what does that tell you?
That it's not inflamed?
Exactly right, okay? So if the approach that you're taking isn't working, it should kind of tell you that that is not the problem, all right? Because if you've taken it for 5 minutes, then it would be a different thing. But you've taken it for long enough for it to have kind of made a difference for you, if that was the problem. Okay, so going back to, we've talked about nerve supply. Everyone's got that now, that the nerve supply from your neck may be a problem. If you've got arthritic change in your neck, let's say that your neck, you have an x-ray taken, and the lower section of your neck looks like this, instead of looking like this, which as you can see the space, you can look at the bones, and you can see that the space between is narrower. What that will potentially do is create an irritation on the nerve supply, okay? And it's that nerve supply that then is impeded with regards to the communication, the messaging that that shoulder is getting from the actual neck itself, okay? So it's a little bit like turning a dimmer switch for an electrical supply. So it's not an on-off, it's like a dimmer switch. That means that you slowly lose the function because it doesn't happen very, very suddenly. Would everybody agree that it's kind of like a slow process? Isn't just that, but one day you wake up and slowly, you might be sort of thinking, I'm sleeping on my shoulder, my sleep isn't great, and then you toss and turn, and then it gets a little bit worse, and then it gets a little bit, but it's rare, unless you've had a trauma, that it happens suddenly. Are we in agreement with that? Yeah? So, if we have an irritation to the nerve, and we've got inflammation, what is the solution to that? What can we do for that?
Physio?
What system does a physiotherapist normally work on?
repeated exercise.
Exercises. What system do exercises work on?
Muscles.
On your muscle system. And you've already told me that you don't think it's a muscle issue. So when you see a physiotherapist, they're excellent at massage. You know, even if you have needles put in, dry needling or acupuncturist needles that you may have tried, then that's excellent, but it doesn't work on the nerve supply. It's only working on the muscle, because they're not necessarily going to be doing a lot to the neck. They're working on the actual shoulder still. And it's not, I'm not saying that you don't need the shoulder work doing, because that may need to be released as well, but it's not still working on the underlying cause of the problem, potentially. So we've said that if you've got an irritation to the nerve supply, that needs to be checked. Number one, is it that is the problem? And you would potentially need to go and see someone who can do that level of investigation. Is it just the shoulder? Is it like a weakness? Is it mechanical within the shoulder? Or is it as a result of irritation within the neck? Now, Jill said there that sometimes the nerve supply to your shoulder can actually come, not that all of it comes from your upper back, but it can be, you can have an irritation in your upper back region here as well, which can contribute also towards problems within the shoulder. That's where it is that you were talking about with, oh, like I can feel something if my pelvis is always wonky, then something up here is going to have to adapt, and then I'm going to end up potentially with a problem there as well. So again, the recommendation would be for you to go and see someone who's going to look at everything, not just the shoulder issue that you've got. So that you're challenging, you're looking at all of the different things that could be contributing towards your shoulder concern. So muscularly, yes, you could have a massage, you could have some dry needling done, you could have acupuncture done. It's going to work on the muscular component, and that is important. But the potential for the problem to come back again is quite high if you've not looked at the underlying cause. Are we in agreement to that?
Mm-hmm.
Yeah? So if you are looking for something that's a deeper solution, that's where it is that myself as a chiropractor comes in. So exercises, we've got a little sheet for you to take away with regards to the simple exercises that you can do in many circumstances to help yourself. That's my daughter. I put it on Do Not Disturb and she's still calling. She can see that the calendar says that I'm doing a workshop, but she's still calling. So we've got exercises that you can do. You can have your massages, you can see the physio, etc. But if you are looking to see, is the problem coming from my neck? Is the problem within the shoulder? Do I need to get my shoulder x-rayed? Do I need to get my neck x-rayed? Could it be that I've got an imbalance somewhere else, which is knocking me off somewhere else? That's where it is that myself and my colleagues within the practice here come in. So what we do here is that level of assessment. So what we would do is, you'd come in to see us, you were going to discuss with you what your specific concern is, and all the things that you've tried, the things that you haven't tried, etc. From there, we would we would actually take like a picture of you to assess your posture. Because hands up those who agree that we could all do better with our posture. Yeah, we're in agreement with that. Most of us, including us that work here, we know that we could all do with improving our posture. It's habitual that we kind of go into comfort, slouchy kind of mode a lot of the time, okay? So we assess your posture. Then what you would potentially have done is, if it's relevant, is x-rays taken of the area of your spine where we think that the problem may be coming from. So if it's your mid-back that appears to be very rounded, then that would be something that we would take an x-ray of. If it's your neck that appears to be wonky and tilted and over to one side, then that's something that we would get evaluated. Does everybody agree that it's a good idea for us to at least have an evaluation?
Mm-hmm.
Yeah, that you want to see, and I'm not concerned whether you come to see me, but you should definitely not just expect it to go away, because how has that approach worked for you so far? With just wishing and praying that it's going to go away without any intervention. I'm telling you, you would be extremely lucky if, without any input, the problem is just going to go away by itself. Because those of you that have a frozen shoulder, the pain may go away after 18 months to 2 years, but then you're left with huge limited mobility. And that's the whole point, is that you want to be pain-free, but you also want to have the movement as well. Are we in agreement there? Yeah. You want to have both. You can't. It's like you want your cake and eat it. You want both. So, and I totally get that. So that's why it is that we've got a sheet of exercises for you to take away. But that is the point about the conversation that we've had, is that it's multifactorial. Hopefully, does anyone want to give me a takeaway that you've learned about what it is that we've discussed already so far this evening? Don't all rush at once.
I've just realised I've had a neck problem for a long time due to an accident, and I've just realised that the shoulder probably isn't the problem, although I think
it could be coming from the neck region. That's why I think it's totally appropriate, if you had something done and it's not showing anything, then the next best option is for you to look to see whether it is coming from the neck region, because that's the first go-to that we look at. We look at your neck, we'll look at your upper back, but we'll obviously assess all of your posture as well. So, anybody got anything else that they may volunteer that they've learned?
I think mine's the neck as well. I keep getting pains
radiating.
up my arm and hand.
That's your neck.
Yeah,
That's what they told me. That's why they sent me, because all my pain was coming down here, and my fingers were getting numb.
Yeah, and that is, you mentioned earlier about discs. Then, depending upon how you're holding yourself, you don't randomly, unless it's through a major trauma, get a disc problem. You don't. It's not just bad luck. There is a physicality to you getting the problems that you do. Your body is not stupid. It does things for a reason. It's up to you to be able to understand and interpret what those reasons are. Are we in agreement with that? Yeah. So,
if we can do like swimming, is it real happy?
Potentially, but it depends upon, again, what it is that the cause is. And if you've got a nerve irritation and you're not addressing the nerve irritation, then moving the shoulder through an extreme range when it doesn't want you to do that, you're going against what it is that your body's trying to tell you. So that's the thing, but it's very, very individual. So in comparison to other workshops I do, shoulder and rotator cuff type of injuries, it's very challenging, because there's such a broad spectrum